Sheltered since early childhood, Reina Harpers lives with a life-threatening sensitivity to sunlight. She is housebound during daylight hours and is cared for by her mother, Karen, and her friend, Faida. Reina only comes out of the house every night once the sun has set. Ariel Mindel is the new neighborhood cutie. He is a first-year medical student of Liceo de Cagayan University College of Medicine. One morning, while having his daily jog along their subdivision, he felt like someone was watching him through the window of this creepy house in the corner of the street. He tried to ignore it, thinking it was just his imagination. But as days passed, the feeling of being watched never left him.
Pagdali, dito sa mid. Pagdali.
Dali, SS.
Pagdali ba? Ina ko dali, SS.
Dili gani mo.
Kabalo ba katong dito na gipatay dito vampira ay.
Wala ka.
Nga di sad ka mo to, talawan man ka.
You have been slain.
Muli na ko gabi na mangud kayo oh.
Dali. Samahan kita. Bay, pila pala yung grade sa Barcam?
Biochem ay, as usual, bagsak. Ang bot, sa oras namin biochem ay.
Kailang yan.
Ang bot, madoktor ba tahan eh? Asa ni nga balay? Muragal mo kita ni nga balay ba eh?
Ida, oo nga.
Haunted lagi siya eh. Kita,
Takot.
ang sa to? Flashlight daw, flashlight. What's that?
Naman, bay.
Was that a vampire? Or white lady?
Hadlok ka, bay.
Ano mo, uli ra ba ka?
Ay, dili. Dito na ako matulog.
Dito na ako matulog.
Ayoko. Takot ako.
Sige, tara.
One night, Ariel was walking in the park when he saw Reina.
Bye.
Hi.
You know, you really have a nice voice.
Thank you.
Pero alone man lagi.
Wala lang.
My name is Ariel. Ikaw?
I have to go.
Ha?
Nanong ulawon gid kay ko eh. Dili gid ko makalok sa iya eyes. Gwapo mo kay siya eh.
Besh, gwapo man din siya, Besh. Oh.
Yang mama gwapo. Sure eh. Pero besh, last night nakita kami gabi. Kabalo ka gusto gid kong TikTok ano niya. Pero ambot eh kaning ako pagka-shy to the highest level na gid eh. Siguro tama na lang ko ani pasulyap-sulyap. Kabalo na ka besh nga bawal ko ma in love. I don't want to love someone and leave them behind.
Kung wala ka nang makapitan, kapit ka sa akin, kapit ka sa akin, hindi kita bibitawan.
Tungod sa kasakit, nag-decide si Faida nga dadon sa park ang iyang amiga nga si Reina aron mawala ang iyang kasakit ug iyang mga gipanghuna-huna. Apan wala sila kabalo nga sa ilang pagpadung sa park, ilang matagbuan sa dan ang crush ni Reina nga si Ariel.
Jamming kayo? Bigay ako mag-gitara.
Sure, dito ta sa Park, oh. Dito mo hangout place.
Jay.
Yan, nisugot man ka nga. Di ba kabalo naman ka sa sulti ganina?
Bish, okay na lagi na. He's making friends, oh. He's no harm.
Tungod sa gibuhat ni Paida ug tungod sa iyang pagsungog-sungog sa ilang duha, pirmi na magkuyog si Ariel ug si Reina kauban si Paida. Magsige silang kanta-kanta, sige silang kaon, hantod na abot ang panahon na na-inlove sila sa usa-usa.
Walked alone, no one by my side. Now I walk with you, with my head held high in the darkest sky.
One night, while Ariel was at home, he remembered the piece of paper he picked the first time he met Reina. It was a wish list. Ariel did his best to fulfill whatever is on the list, but among them, the last one seems to be strange.
Don't you ever give up. It's so hard to be something when you're not. But I have
I'll catch you if you fall. Andito lang ako.
Sure? I-catch ko niyo, ha?
Saan tayo?
Okay.
Okay, now break. Break. Kasi start.
Dili mo ko nang ginakat.
Tayo ka maayos.
Okay.
Okay, 1, 2, 3, go. Oh. Break.
Oh!
adrift.
What's the matter?
Almost sunrise na.
And then?
Iuwi mo na ako sa bahay namin. Tara!
Nidagan og paspas si Reina papauli. Apan galibog si Ariel unsay problema sa sunrise. May gali naabot siya sa ilang balay before sunrise.
Wala, pagapon yung manaingan, iha.
Di ko gusto makabalo siya, Maui. I want him to see me as a normal person. I don't want him to see me as a disease.
You have the disease, but you're not the disease itself. And I bet Ariel will accept and still love you.
Reina has been hospitalized for a few days, and Ariel has been looking for her everywhere. No calls, no texts, nowhere to be found. And as desperate as he is, he comes to Faida.
Faida, please. Where's Reina?
She told me not to tell you, Ariel. But I can see na desperate na kay ka. She's sick. And gikan pa siya sa hospital karon. For the rest of the information, you can ask her.
Miss Anita, ano ba nangyari sa'yo? Sabi ni Paido, may sakit ka daw. Please, sabihin mo sa akin, ano nangyari?
I have something to tell you.
Reina was always sensitive to sun exposure. It was only when she started showing severe signs of her disease that she was brought again to the hospital to be diagnosed. She always longed for the outdoors, where she could feel the warm breeze whisper and the warmth of the unforgiving sun. Yet just for a few minutes of exposure, she would have severe sunburn. Painful eyes that were hard to bear, and poor coordination that included difficulty in walking, swallowing, and talking. They decided it was time to consult an expert. Upon assessment, Dr. Umpar suspected xeroderma pigmentosum, basing on her symptoms and the results of her clinical examinations. She then encouraged Reina to undergo genetic testing to confirm her condition.
Doc, am I okay?
We have the result from your genetic test, and it says here that you have xeroderma pigmentosum. It is an inherited disorder which causes the skin and the eyes to be extra sensitive to sunlight and other sources of UV. It happens when one of the genes or one or more of them don't work completely correctly, or they don't work at all. And this is basically in the DNA in your nervous system.
Doc, what happened to me now? Am I gonna die?
To be honest, people with XP are at a very high risk of developing skin cancer and other cancers. And usually, patients with this disorder have they usually die at an early age. But in your case, it is good that we have reached a diagnosis, and we now know that you have xeroderma pigmentosum. And for now, we should undergo some further tests to confirm if you have neurological disorders that could complicate it. And if you have none, I hope so, then what we can do is, at all costs, you have to avoid exposure from all sources of UV.
Reina was overwhelmed with the news of the possibility of her dying. She had so much she wanted to do, so many places she wanted to be, where she wasn't confined to the darkness of a sunless life.
Alam mo, Reyna, akala ko talaga white lady ka.
Paano mo nasabi?
Kasi one night, kasama ko si Bash, yung best friend ko. Lumalakad kami, and then napupunta kami doon sa bahay nyo. And then nag-flashlight kami, nakita-kita.
Ikaw mo dito?
Oo.
Sakit talaga kung mata-ato buwanga mo. Katong inyo na dunggan nga naglagubo.
Oo.
Namang ginatagak ato. So ako gitry og kabot.
Alam mo, Reyna, hindi ko talaga alam. Sa dami-dami ng tao, ikaw pa talaga binigyan ng ganyang sagot. Hindi ko tuloy alam kung paano ko i-fulfill lahat ng wish mo sa wishlist mo. Pero,
Nada sa imo, ha?
Ha? Ang ano?
Ang wishlist.
No. Sorry, Rita, sorry. Alam mo, gusto ko talaga siyang i-complete, pero hindi ko talaga kaya i-complete yung last wish mo eh. Ayaw kitang masaktan.
OMG! I thought you were my soulmate because you completed my bucket list. And then all of the sudden you read it all. So you're making funny to me, to make me foolish.
No. No, babe. No. No, Reina. I can't make you fool. Alam mo naman kung gaano kita kamahal, di ba?
Okay. Pero, can you complete my last wish list?
Sige, mapainit ka. Gusto mo talaga yan? Kaya,
I wish I could stand on a star. I wish I could be where you are. They say don't you ever give up. Above ground where I stand so proud. My face glowing loudly through the crowd as I walk with the beauty of the night. But I have walked alone with the stars in the moonlit night. I have walked alone, no one by my side. Now I walk with you, with my head held high. In the darkest sky, I feel so alive. But I have walked alone with the stars in the moonlit night. I have walked alone, no one by my side. Now I walk with you, with my head held high. In the darkest sky, I feel so alive. I'll always see your face, the corner of your smile, and all the little things no one will ever know. Like it was yesterday, won't ever fade away. Goodbye is just a word I will never say. You will never be forgotten. A million days could pass us by, but what is time but just a dream?
Our DNA is subjected to a huge array of chemical, physical, and biologic assaults on a daily basis. Hence, efficient recognition and repair of DNA lesions is essential. The repair of damaged DNA is critical for maintaining genomic integrity and thereby preventing the propagation of mutations either horizontally from somatic cells or vertically from germ cells. Any DNA damage that will occur if not repaired will lead to DNA mutations or possibly disease. Xeroderma pigmentosum is an autosomal recessive genetic condition caused by alterations or mutations in 9 different genes. 8 of the genes make up the nucleotide excision repair pathway that identifies and repairs UV-induced DNA damage. The 9th gene acts to bypass the unrepaired DNA damage. Nucleotide excision repair is an important excision mechanism that removes DNA damage induced by ultraviolet light. Xeroderma pigmentosum mostly affects the eyes and areas of skin exposed to sun. Some affected individuals also have problems involving the nervous system. The symptoms begin in childhood. Children with Xeroderma pigmentosum may develop a severe sunburn after spending only a few minutes in the sun, and the burn can cause blistering that lasts for weeks. Other effects on the skin includes dry skin, increased skin pigmentation, skin atrophy or thinning, widening of small blood vessels resulting in thread-like patterns on the skin. Effects on the eyes. Symptoms that affect the eyes occur in approximately 80% of people with Xeroderma pigmentosum. A person may experience photophobia or light sensitivity. The eyes may become bloodshot and irritated, and the corneas, the clear protective outer layer of the eyes, can become cloudy. A person may also develop dry eye, which can result from chronic inflammation of the cornea or keratitis. In severe cases, keratitis can result in obscured vision and vision loss. Repeated sun exposure may also affect the eyelids, causing them to thin and the eyelashes to fall out. Neurological effects. According to National Organization for Rare Disorders, 25% of people with Xeroderma pigmentosum develop progressive neurological symptoms which include hearing loss, limited coordination, difficulty walking, progressive cognitive impairment, reduced muscle control, difficulty talking and swallowing, and seizures. People with Xeroderma pigmentosum have greatly increased risk of developing skin cancer. Without sun protection, about half of children with this condition develop their first skin cancer by age 10. Most people with Xeroderma pigmentosum develop multiple skin cancers during their lifetime. These cancers occur most often on the face, lips, and eyelids. Cancer can also develop on the scalp, in the eyes, and on the tip of the tongue. Studies suggest that people with Xeroderma pigmentosum may also have an increased risk of other types of cancer, including brain tumors. Additionally, affected individuals who smoke cigarettes have a significantly increased risk of lung cancer. Diagnosis is based on the clinical findings and specialized testing on skin cells. The diagnosis can be confirmed by the results of genetic testing. Treatment is focused on managing the symptoms. This includes avoiding sun exposure and performing frequent screenings for skin cancer and other cancers.
Na-open ko na. Na-open.
One, go.
Wala man sa tono yung sayaw natin, Pais.
Kahilom ninyo. Storya! Ano ka storya?
Galawin mo. Hindi ka na nasasabihin ko. Ano sasabihin ko? May sasabihin ba ako dyan?
Ikat o ikat. Kayo pala yun. Masakit yung mata ko nun ha. Sakit.
Parang kang si Ryan bang magtagalog? Ba't kasi ikaw pa talaga may sakit na yan?
Tayo mabuhat.
Hindi ko talaga wala tayo mabuhat. Huwag ko na magwala tayo mabuhat.
Ay, natural lang. Ako ragi. Yung narinig nyong... Katungin nyo nadunggan nga nila, Gubo.
Fulfill lahat ng
Teka lang,
wish
teka
mo.
lang. OMG.
Kayo na tumatawa. Pinipil na namin.
Okay.
Wait.
Go.
Go. Ba't kasi ikaw lang pa yung binigay ng gas? Tingin ka sa akin. Yan, gano'n. Tingin ka ulit pa. Isa dito. Tingin ka. Ganyan, ganyan, ganyan. Tingin ka sa taas. Okay, yan. Tagal ka. Yan, ganyan tayo. Nice. Diyan lang, diyan lang.
Guys!
Uli na ta?
Yes. Tibok sa ta. Di ko ni mo ginakash.
Mamamatay na siya. Mamamatay na siya.
Isa pa, isa pa. Yan. Hindi ako marunong noon. Oh, ay, joke lang.